60. In what way do the nitrates work? The answer is, nitrates work because it relaxes the smooth muscle layer of blood vessels. The arterial lumen is increased. Blood flow is increased. O2 is increased to the tissues. 61. What is the most common adverse reaction to nitrates? Nitroglycerin. The answer is, the most common adverse reaction to nitrates are headache, hypotension, dizziness, vertigo, weakness, and skin flushing. 62. Describe the actions of the calcium channel blockers. The answer is, the actions of the calcium channel blockers inhibit the movement of calcium ions across cell membranes. The answer is, the actions of the calcium channel blockers inhibit the movement of calcium ions across cell membranes. The answer is, the actions of the calcium channel blockers inhibit the movement of calcium ions across cell membranes. 63. How frequently should NTG be taken if anginal pain continues? The answer is, if anginal pain continues, NTG should be taken during acute angina. Take Q5 meters. Q5 meters means every 5 minutes 3 times in 15 minutes. 64. What is the correct method of administering nitroglycerin ointment? The answer is, the correct method of administering nitroglycerin ointment is, use gloves, rotate sites, and don't rub. 65. At what time of day should the patient apply the nitroglycerin transdermal patch? The answer is, the patient should apply the nitroglycerin transdermal patch in the morning. 66. For what reason should the nurse wear gloves when applying the topical NTG ointment? The answer is, the nurse wears gloves when applying the topical NTG ointment to avoid absorbing any medication into themselves. 67. How long should the ointment or patch be left in place? The answer is, the ointment or patch should be left in place applied for 10 to 12 hours. 68. What part of the body should the ointment or patch be applied? The answer is, the part of the body that the ointment or patch should be applied on is a clean non-hairy skin on the chest, back or abdomen. 69. How should the skin be prepared prior to application? The answer is, the skin should be prepared prior to application by being dry, free of hair, and not subject to excessive rubbing or movement. 70. When a patient reports that the tablet coverings of verapamil calin are expelled in the bowel movement, what response should the nurse give? The answer is, when a patient reports that the tablet coverings of verapamil calin are expelled in the bowel movement. Capsule casing found in stool are normal and pose no harm. Capsule casing found in stool are normal and pose no harm. Capsule casing found in stool are normal and pose no harm.